Good afternoon, dear listeners and viewers of Equinoxe Radio Multimedia. It is with pleasure that we join you all out there for another edition of your health program, You and Your Health, aired on Equinoxe Radio Multimedia. For presentation, I am Esia Luciliengu. It's the second most frequent cancer among women in Cameroon, with a high mortality rate from the year 2023 to date. And in the year 2023, statistics provided by HPV Information Center revealed that approximately 2,770 women were diagnosed with cervical cancer, that's each year, and more than 6 million Cameroonian women aged 15 and above are considered at risk of having cervical cancer. Today we will be looking at discussing the causes, risk factors, but also preventive measures when it concerns the pathology of cervical cancer. We'll be discussing this with a general practitioner practicing here in Douala, precisely in Bonaberi, in the Douala 4 subdivision, Dr. TANG Chiara. Good afternoon and welcome to Equinoxe TV and radio.
Thank you, Madam Lucy. Thank you for having me here.
All right, without a waste of time, we go directly to the first question. Doctor, this is your domain. You are practicing when it concerns cancer, but specifically cervical cancer, other forms of cancer that do exist. We would like to know, what is cancer all about?
All right, thank you so much. That's a very interesting question. Cancer is a disease where certain cells in the body develop and grow uncontrollably. Because normally the body cells, they grow, they divide, and they die at a certain time. But these abnormal cancerous cells, they grow and they die and they spread to other parts of the body uncontrollably.
What is cervical cancer? We have been talking about, for my introduction, I made mention of cervical cancer. What is this disease all about?
Okay, cervical cancer is the cancer of the cervix. The cervix is the lower part of the uterus opening into the vagina. So this cancer starts with abnormal modification at the level of the cervix. We call it the precancerous cells. So this cancer, it is mostly caused by a virus called the human papilloma virus. That is it.
Let's go right deep from the roots. Let's talk about the common risk factors associated with the disease.
Okay, that's very good. The risk factors associated with cervical cancer, we have women that are frequently exposed to human papilloma virus. We have early onset of sexual intercourse. We also have people that are smoking. And we also have people that have a lower immune system, a weaker immune system, like, for example, those that are infected with the HIV virus. We also have, of course, people that don't go in for frequent cervical screening.
Can we say hygiene too can lead to this condition? As a lady, when you're not clean down there, can hygiene also lead to this?
It has not been proven that hygiene can lead to that.
All right. So when we are suffering from this condition, as a woman, as a lady, as a young girl, as a child, because we say from the age of 15, how do we know that we are suffering from cervical cancer or cervical cancer, looking at the signs and symptoms?
Okay, when it comes to cervical cancer, it starts with a very silent effect. There are no symptoms in an early stage. But when the disease is a bit advanced, that is why, first of all, we recommend early screening, because we can only start having symptoms when the disease is already advanced. And at this advanced stage, we can have symptoms like pain after sexual intercourse or bleeding. We can also have bleeding when a lady is already in her menopause. We can also have pelvic pain and pain during sexual intercourse.
Ladies and gentlemen, we are looking at the causes of cervical cancer. We are looking at the prevention methods. If you are out there and you're facing this condition, you're encountering this on a daily basis, or some of the symptoms which the doctor has made mention of, you have your questions, you have your worry. This is a time, this is a moment for you to ask your questions. We have the following numbers: 670-5470-49, 670-5470-49, 656-62-2222, 656-62-2222 at the end. And back to you, doctor. We also want to understand in simplest terms, at what age should individuals be aware of this condition?
Okay, generally, the screening of cervical cancer starts at the age of 25 and it runs through to the age of 65 years old.
All right. So, who are those who are more at risk? In your hospital, you are a practicing medic in this profession or in this field. At your hospital, in a day, approximately how many patients do you receive?
When it comes to cervical cancer, let's take maybe our country. You started the introduction by giving some statistics about that. It's important to note that cervical cancer is one of the most common causes of cancer in women, and it also has a high mortality rate. So in our hospital per se, especially during this period, we have had about 2 to 3 women that we have been having that suspicion of cervical cancer due to the need for this sensitization.
All right, you made mention of sensitization, but before we get to the campaign, because we know that the month of October is observed as the pink month, that's the pink month awareness for, especially for breast cancer, cervical cancer, and other types of cancer. And now, what are the recommended screening methods that are available in our country right now when it concerns the diagnosis of the disease?
Okay, when it comes to cervical cancer, we have the pap smear. I think a lot of us know about pap smear. The pap smear is there to check the abnormal cells at the level of the cervix. We also have the human papilloma virus test, that is to detect the virus that is present. We also have another common test because it is low cost, which is the visibility of the cervix with the acetic acid.
At what stage, let's say you maybe start encountering the signs and symptoms, at what stage should a woman be worried that at this stage I should rush to the hospital for screening or diagnosis?
Generally, we advise that, like I earlier mentioned, from the age of 25 years old, a lady is supposed to start her screening because those who are exposed, I did mention the risk factors. You have those who started sexual intercourse at an early stage. We have multiple sexual partners. So, and I did mention that at an early stage, we don't have signs. It's a silent disease. We start having symptoms when the disease has already advanced. That is actually why it is important to start screening early enough.
Ladies and gentlemen, sure you have your questions. The numbers are on your screens, and also we have 670-547049, 670-547049, or you can join us via 656-62-2222, 656-62-2222 at the end for your worries and for your questions. Back to you, Doc. How often should women get the pap smear or the HPV test?
Okay, thank you so much. That's a very, very interesting question. When it comes to pap smear, when you do your pap smear, if it's negative, you can repeat it after 3 years. Now, if you do your HPV test, that is the human papilloma virus test, if it's negative, you can repeat it after 5 years. But due to unlimited, financial resources, we can do it at least 5 to 10 years rather than not doing it at all.
Can we say that the amount is somehow exorbitant or expensive? Is that the reason why some women stay away from hospitals when it concerns a screening test?
When we are talking about finances, it depends on the class. Some people, if a test is about 20,000, to some people, they cannot afford it. So we are also trying to consider those people that from a very humble backgrounds, that even a test of around maybe, let's say, 5,000 are unable to afford. So we try to consider those people as well.
We have been looking at the HPV test. We also like to understand, what is the HPV vaccine all about?
Okay, the HPV vaccine is the strongest tool we have to fight cervical cancer, because this is a vaccine that it is there to protect women from having cervical cancer. Because cervical cancer, one of the most common, the highest causes actually of cervical cancer is the presence of the human papilloma virus. So it is a vaccine that it is recommended for young girls who have not yet started with their sexual activities. It is also a virus that is very safe to use. It is very effective. So that is why we recommend ladies out there to sensitize your children, get your children to get the vaccine. It is very safe.
Before we get to the campaign, we would like to understand, are there some other health conditions that are associated with cervical cancer?
Okay, from the definition of cancer, I told you that cancer is when certain cells in the body, they multiply in an uncontrollable manner, and they can spread to other parts of the body. So they can diagnose you of cancer, but you can multiply to other parts of the body. That's when we start talking about metastasis, and you start having other complications. It can multiply, let's say, to the lungs, to the bones, and you start having different complications. A patient can even come and the patient is having a problem that has to do with the lungs, whereas it's as a result of the cervical cancer, the metastasis, the fact that that cancer spread to other parts of the body.
Now let's dive into the real question. We are also looking at the campaign. Despite the fact that in accounting today, we know that most people scare away, like I mentioned, from screening tests and also from vaccines because of certain reasons. Let's talk more about the month of October, which is coming up in few days. It is observed as the pink month for women. Let's talk about the role of campaigns. Let's look at the role of campaign, especially in our Cameroonian society when it concerns the diagnosis of cervical cancer.
Okay, campaign in general sense is an opportunity where we give to the population to be able to take to do some tests at the minimal cost, to be able to get some information about some diseases they are not aware. So like in our hospital, looking at the Pink October, we carry out community talks to sensitize the population about breast cancer and about cervical cancer, because most of the times when we think about Pink October, many people are focusing on breast cancer, whereas we also have cervical cancer. So the hospital using this opportunity to sensitize on the cervical cancer, give some talks, do free consultations, and do some lab tests. Most lab tests they'll be done at discounted rates, because campaign is an opportunity where we are able to sensitize so that people can be able to do early screening, so that when it comes to the treatment, we can easily treat at an early stage without having to wait.
So far, how is the affluence, how is the atmosphere? Are Cameroonians interested in campaigns when it concerns health conditions?
Yeah, that's very, very interesting. Yes, when it comes to, generally the population knows that when we are talking about health campaign, a lot of things will be done at an affordable prices. So it is a period where the hospital is crowded, patients are trying to do most of the exams, because it's true that it is Pink October where we sensitize the population about breast cancer and cervical cancer, but we are not leaving out other diseases. So we make sure that we don't subsidize only at the level of the breast or at the level of the cervix. We also subsidize on other common diseases that we think that the population will need.
Good. At the level of your hospital, what are some of the treatment options available? And can we say that cervical cancer can be treated?
Okay, when it comes to cervical cancer, treatment will depend on the stage of the cancer. So if the cancer is still at an early stage, just with surgery, we can completely remove the cancer from the cells. So then, but when the cancer is already at an advanced stage, we can use chemotherapy, we can use some radiotherapy. But now, when it is too advanced at a stage where we cannot control, what we can do is just palliative treatment. Palliative treatment is a treatment where you're just trying to reduce the patient's pain and maintain the patient's dignity, because, at this stage, there's basically nothing that can be done.
Yeah, I want us to focus at your hospital. We are talking about the treatment options available, accompanied with the campaign that is ongoing.
Okay, at the Peace and Comfort Medical Foundation, Bonaberry, the treatment options that we have the surgery, because we have a gynecologist that is in place, and we work in collaboration with the oncologist. So when we have a patient who is at an early stage, we can easily do the surgery, but when it's already at an advanced stage, we refer to bigger hospitals for adequate management.
Any last words, any last advice for those who are watching out there, for patients out there, for those who are suffering from the condition, but not just only those who are suffering from the condition, because that as a young girl, you can't be exposed to the risk factors. Any advice for them?
This advice will go to the women out there. If you're listening to us today, I encourage you to come for early screening. It is very important, because it is with this early diagnosis that we are able to manage you properly. So I urge even the fathers, you talk to your daughters, you encourage your wives to go out there, because we are not just focusing on women. The fathers are there, the husband is there to encourage, to push these women out there so that they can easily screen, they can easily get detected, because cervical cancer, the symptoms start manifesting at a later age. But if we make good use of this opportunity, this campaign that we are doing at Peace and Comfort Medical Foundation, Bonaberry, we can be able to detect it and save you from a lifetime danger.
Thank you very much, Dr. Tang, for being our guest on today's program. You and your health aired on Equinoxe Radio Multimedia. Sure, we'll be having you again here next time.
Thank you, Madam Lucy.
And thank you, ladies and gentlemen, for staying with us till the end of the program. For presentation, I have been Esia Lucy Liengu, technically assisted by Jonathan Babiola and Louis Pego. Do stay in the company of interesting programs on Equinoxe Radio and television. Bye-bye for now.